My name is Maite Hernández Aguilar. I am the International Delegate for BFHI Spain, IAN. The case study I am presenting illustrates Breastfeeding Collective Call to Action number 7. Funding is needed for training professionals on breastfeeding counseling. IAN Spain is a not-for-profit organization that aims to humanize birth and protect breastfeeding, and it is also the NGO responsible for the implementation of the BFHI in Spain. Spain is a European country with 49 million inhabitants, with a high life expectancy, a low fertility rate, and a low infant mortality rate. Breastfeeding indicators could be better. Spain lacks a breastfeeding national policy and has no designated breastfeeding global authority. The country does not report indicators to the Global Targets Tracking Tool, and the World Breastfeeding Trends Initiative scorecard shows several areas of improvement. Healthcare professionals training in Spain is mostly funded by the industry of breast milk substitutes and or the pharmaceutical industry. Aiming to improve this situation, IAN fosters nationwide BFHI implementation, advocates for breastfeeding protection, and implements a breastfeeding counseling training program for healthcare professionals. This program includes training trainers and training healthcare in service and pre-service, using different techniques, including e-learning. Our efforts resulted in nearly 2,500 healthcare professionals receiving basic breastfeeding counseling training and more than 1,300 healthcare professionals receiving in-service breastfeeding counseling training. BFHI practices implementation in hospitals and community has improved, as well as breastfeeding indicators. Funding is needed even if IAN counts on a substantial amount of voluntary work. IAN activities were partly funded by UNICEF in the early years, and we also managed to raise funds by publishing a breastfeeding guide for healthcare professionals. But most of our funding came from advocacy. We advocated with the National Pediatric Association and regional and national authorities, and we managed to get partial funding. Funding from the Pediatric Association was, however, suspended when IAN required that they abided by the code. Furthermore, governmental funding has been intermittent with periodical interruptions due to political changes or priorities. In summary, aligning with families, being transparent and abiding by the code, voluntary work and advocacy efforts have been our best tools to raise funds to implement this program. Thank you very much.
Breastfeeding Buddies is a community-based peer support program that has been active in Waterloo Region, Ontario since 2001. Breastfeeding Buddies aims to assist families to meet their breastfeeding goals through feeling connected and supported in their community. With a population of about 617,000, Waterloo Region includes 3 fast-growing urban cities and is surrounded by rural communities. Canada has a universal, publicly funded health system, and the Breastfeeding Buddies program is located within a not-for-profit community health centre. In Ontario, families want to breastfeed. Over 91% of mothers initiate breastfeeding in the hospital, but exclusivity and duration rates drop steadily over time, with only 33% of babies receiving exclusive breast milk at 6 months. Breastfeeding Buddies is a large peer support program with 147 volunteers. To become a buddy, a mother must breastfeed for at least 6 months and complete the program's 18-hour World Health Organization peer-based training. Buddies facilitate prenatal breastfeeding courses, and families can be matched by text, phone, or in person before or after their baby is born. The Breastfeeding Buddies community model relies on partnerships to connect with families facing barriers, such as young mothers, refugees, and parents using substances. In our view, breastfeeding rates are indicators of a community's success or failure in supporting families, not the individual failings of mothers. We offer strength-based, non-judgmental education and advocacy that aims to boost personal self-efficacy and informed decision-making. To grow and sustain a robust volunteer program, we have learned that developing mother-friendly volunteer opportunities that are flexible and include funding for childcare, food, and transportation is very important. We have also learned that building a culture of mutual respect between peer support and community-based leadership means more inclusive support. By using an evidence-informed model of training, peer breastfeeding volunteers are seen as capable and as credible sources of breastfeeding support. As a community leader in normalizing breastfeeding, the Breastfeeding Buddies program works within systems to make change and strongly believes peer breastfeeding support is essential in helping families reach their breastfeeding goals and ultimately creating a healthy, vibrant breastfeeding culture.
Good morning, good afternoon. My name is Natalie Likite. I am the Social and Behavioral Change Advisor at Alive and Thrive's West Africa Initiative. Since 2013, the Ministry of Health of Burkina Faso has been implementing its scaling up plan for the promotion of optimal infant and young child feeding practices. This plan runs from 2013 to 2025. One of the objectives of the plan is to increase the rate of exclusive breastfeeding of infants under 6 months of age up to 80% by 2025. Alive and Thrive and UNICEF support the Nutrition Directorate of the Burkina Faso Ministry of Health to accelerate the achievement of its breastfeeding goals through the Stronger with Breast Milk Only campaign. This case study emphasizes the importance of policy advocacy, funding resource mobilization, and capacity building of both facility-based and community-based health workers to offer skilled breastfeeding counseling to women. The goal is to provide women with high-quality counseling and breastfeeding support during at least 6 routine maternal and child health visits at no extra cost to families. The case study urges governments to put in place policies and directives and mobilize appropriate funding to achieve that goal. Burkina Faso's Nutrition Directorate, Alive and Thrive, and UNICEF brought together their unique skills and resources to support the Ministry of Health in the design and implementation of the Stronger with Breast Milk Only campaign. Evidence produced convinced the government of 3 things. First, to take ownership and leadership of the campaign. Second, to develop a national social and behavioral change strategy, which helps align its stakeholders around common objectives. And third, to support the implementation of a new training module and counseling tools focusing on exclusive breastfeeding. The government successfully mobilized additional financial resources of more than $1 million from the National Health Services Strengthening Project financed by the World Bank. This funding will help strengthen the skills of 15,600 health workers and 18,000 community health workers across Burkina Faso. These results show that working with the government to build the capacity of the ministry to design, plan, and implement quality nutrition services, including breastfeeding counseling, is possible, necessary, and inevitably involves this building strong relationships and investing time and resources.
En el llamado a la acción específicamente el número 2 sobre la formación de personal de salud para el fortalecimiento de sus capacidades en brindar consejería en lactancia materna. En este caso, la carrera técnica universitaria de partería de la Universidad Da Vinci de Guatemala ha implementado dentro de su malla curricular el contenido sobre consejería en lactancia materna.
La carrera de partería surgió como una necesidad materno-neonatal que se incluyó, ¿verdad?, de parte del Ministerio de Salud Pública. Les comento, ¿verdad?, la carrera de partería, como su nombre lo indica, ¿verdad?, hizo convenios con Universidad Da Vinci de Guatemala, con JH Pliego y la Universidad Autónoma de Perú. y desde luego, ¿verdad?, de coordinación con USAID y con el Ministerio de Salud Pública y Asistencia Social, para que de esta manera nosotros formáramos a personal capacitado para poder incluirlo, ¿verdad?, en las áreas más vulnerables donde se presenta la mayor parte de casos de mortalidad materno-neonatal.
Realmente el entender, el ponerse en el lugar de las personas que van a experimentar todos estos cambios nos hace que haya una persona que los pueda atender, y en este caso pues la persona idónea es la técnica universitaria y que lo va a experimentar bien porque se siente acompañada, se siente apoyada en los servicios de salud y sobre todo se siente feliz, que eso es lo que uno quiere, que cuando estos procesos se den tengan experiencias positivas. Una de nuestras mayores satisfacciones que es la atención de calidad, pero a través de entender a las usuarias con las cuales vamos a trabajar y les vamos a poder brindar lo que ellas necesitan en cuanto a la especialidad de la parte.
¿Puede usted contar cuáles son los principales desafíos que en su práctica ha encontrado en torno a la consejería en lactancia materna?
Entonces un desafío es con nosotras como parteras explicarles la importancia de lo que es, principalmente lo que es la lactancia materna exclusiva, ¿verdad? El hecho de que los bebés hasta los 2 años es necesario que ellos tengan una lactancia principalmente de 0 a 6 meses, que es donde trabajamos lo que es la lactancia materna exclusiva.
Hemos brindado educación sobre lactancia materna, haciendo mucho énfasis en los beneficios y explicándole a ellas las vitaminas y nutrientes que contiene la lactancia materna.
Estamos conscientes y muy satisfechos de la labor que tanto estudiantes como docentes van a desarrollar en esta área, y que eso favorecerá sobre todo la promoción de la lactancia materna en nuestro medio, y eso ayudará a mejorar la salud y nutrición materna infantil de nuestro país.